where unemployed doctors are staging a sit-in outside the Premier's office in Pietermaritzburg over vacant posts in the healthcare sector. Today marks their third protest since January to highlight their struggle to find jobs and the broader crisis in the sector. Newzroom Afrika's Ndlovu is tracking that story. She joins us now live with the latest. Siletiwe, good afternoon. It's been almost 7 months now of these doctors protesting, and I believe their protests go back even further than just this year. Has any progress been made? What is the latest?
Good afternoon, Michelle. Well, at this point, we understand from the conversations that we've had with some of the doctors that there's no progress at this point that has been made, which is why once again this morning here in Pietermaritzburg, outside the Premier's office, they are once again holding a sit-in. They have raised a few demands, Michelle, obviously calling for immediate employment, but also calling for support when you're looking at rural healthcare facilities. Now, I'm just going to bring in Dr. Sethabile Molefe to highlight some of those demands that they have and also just some of the concerns that you also have once again this morning. Just firstly, talk to me about the concerns that you have as you are gathered outside here.
Hi, Lily. We're part of the KZN Unemployed Doctors. Our main concern is the unemployment. Okay, so we're post-community service doctors, which means we've completed our 6-year undergrad degree in medicine, and we've done 2 years mandatory internship and also 1 year mandatory community service, which is part of the training as per the internship and community service program. So we are now officially independent practitioners who are relying on employment in the public sector to be able to pursue our careers and also to specialize, as it's what we mostly want to do. We do not accept any of the solutions that have been posed to us, which are to either go overseas or open our practices, because we want to serve the communities from which we come from.
And talk to me about, I know earlier on we mentioned that some doctors that we have here have been unemployed for more than a year. Talk to me about the implications of, it seems at this point, the provincial government not stepping in to assist.
Okay, so I myself and some of my colleagues have only been unemployed for 6 months as we completed our community service end of December. But we are with colleagues who have been unemployed for more. There's some colleagues who have been unemployed since the end of 2023, which means they are 1 year and 6 months in unemployment. The implications of, I can go on all day in terms of the implications. Unemployment means that in the public sector, there's long waiting lines, long waiting periods for surgeries. Our colleagues who are currently employed are overburdened, they're overworked. There's short staffing. All these things they're not exclusive at all. We recently had the death of a colleague in Prince Mshini Memorial Hospital who couldn't take sick leave, who was denied sick leave because of the fact that there is short staffing, and he was not coping, and it unfortunately led to his demise. So there is lots of implications based on this. And we have annual cycles in the community and internship. We have mid-year cycles. Most of us here are from the annual cycles and the mid-year cycles that ended last year. But at the end of this month, we have colleagues who are finishing mid-year cycle of ComServe, and they will be joining this very pool of unemployment.
And what does that mean when we have doctors that are about to join a pool of unemployed doctors? What does that mean?
That means the community suffers. There's long waiting lines, as previously stated. Colleagues are overburdened. We're here, we're ready to serve the community.
I want to talk about the 2.8 billion that was added to the health budget. It seems as if at this point KZN is the only province that is yet to advertise some of those vacancies. Just talk to me about that. Are we essentially saying that it's the provincial government that is to blame?
So when it comes to unemployment, it's not just us doctors. Youth unemployment is a problem nationally. We as doctors are just simply saying we refuse to accept these conditions. In terms of the unemployment, with the budget, with the third budget having been passed, KZN has simply not employed or advertised any posts as other provinces are going ahead. Eastern Cape, Gauteng, they're going ahead and they're advertising and employing doctors. KZN has not released a single post, and we are demanding employment of all KZN unemployed doctors.
And then perhaps lastly, the solution. What do you think is the solution? Because in some cases we have been told that the reason why there's no positions that are available is due to budget constraints. But talk to me about the solution and also just some of the demands that you have this morning.
Okay, so as you already stated, this is our third sit-in. First and second sit-in was met with empty promises, sometimes even purely zero responses. This is our third sit-in, and we are not accepting any more being ignored or any more no responses. We want to be employed. Solution is to advertise posts, employ doctors, employ allied health, so that we can be able to serve our communities.
Dr. Molefe, thank you so much for speaking to us this afternoon. Michelle, that's Dr. Molefe. She's part of the group that we have here. They are, of course, calling for immediate employment, stating that they have, of course, been unemployed for quite some time, some of them even longer than a year, but also speaking to us about some of the implications and how wide they go, particularly when you're looking at healthcare here in the province. We understand that the fact that they are unemployed at this point does impact different hospitals and clinics where you find that there's long queues, a number of community members also continuing to suffer at this particular point. And as you heard, Michelle, from that conversation, they are calling for a solution to this problem.
Yes, because obviously it's not just about the doctors finding jobs, which is incredibly important, but as your guest highlighted as well, it has a major impact on the communities that they could be serving. Siletiwe Ndlovu left us there in Pietermaritzburg. Thanks for that update.